Good afternoon, everybody, and welcome to Psychiatry Grand Rounds. My name is Rothschild. I am the chair of the Grand Rounds Committee. Just a couple of brief announcements. In order to receive credit for attending today's Grand Rounds, please complete the survey, the evaluation in the Survey Monkey that was sent with the Grand Rounds announcement on Monday from Karen Lambert. Grand Rounds will continue to be Zoom entirely for the months of February and March, and we haven't made any decisions yet about what's going to occur after that. Of course, Grand Rounds will always be available on Zoom. The question is whether we will also offer an in-person option, but stay tuned for that. If you have questions for today's speaker, please type them at any time in the chat function, and the speaker will be asked the questions at the end of the talk. There is no Grand Rounds on next week, February 3rd, or the following week, February 10th. The next Grand Rounds will be on February 17th, and the speaker will be Dr. Germa, who will be talking about management of substance use disorder in the outpatient setting. It's my pleasure to introduce Dr. Lala Padilla, who is director of the Psychiatry program and chair of the Diversity, Equity, and Inclusion Committee in the Department of Psychiatry. Dr. Padilla.
Thank you. Welcome, everyone. Thank you, Dr. Rothschild, for the introduction. It is my pleasure to introduce our Grand Round speaker today, Dr. Derek Luzim. Dr. Luzim grew up in the suburbs of Long Island, New York. He attended the University of Notre Dame, where he received a bachelor's in sociology, where he met his wife, Ashley, as well, who I think may be in the audience. He worked several years as a nursing assistant and mental health associate while completing his post-bac pre-medical program at the University of Vermont. And then he remained in the Green Mountain State for medical school. Derek joined our residency program and is currently a senior resident. He served as a chief resident in psychotherapy and is currently a fellow at the Boston Psychoanalytic Society and Institute. He also serves as the chief resident for inpatient psychiatry, which allows him to pursue his interest in teaching and mentoring residents and medical students, which they all appreciate very much. We are excited that he has chosen to remain in Worcester as a member of the UMass faculty after his training is completed. Anyone that knows Derek knows that he enjoys spending time with his family and that being a father of 2 young children is a core part of his identity. He approaches the topic of parenthood with the typical curiosity, sensibility, and empathy that characterizes Derek. So his Grand Rounds presentation today reflects his interest in this process and is titled Fatherhood and Development. Please join me in welcoming Dr. Luzim.
Thank you, Dr. Padilla, for that kind introduction. Hello to everybody, and thanks for joining me today. I imagine standing in front of you all in an auditorium, with slides projected behind me, but we're in the midst of a pandemic, obviously. So while the performance anxiety may be lower, it's a different experience. So here we are together, but somewhat alone. I'm going to bring up my my slides so that I can jump right into it. There's a lot of ground I'm trying to cover today, and hopefully we'll have enough time and have some time for discussion as well. So the title of my Grand Rounds presentation today is Fatherhood and Development. This was sort of already mentioned by Dr. Padilla, but if you've spoken to me for longer than a few minutes, you probably know I'm a father of 2 young kids. Over the last 5 years or so, I've tried to balance career and family without incurring excessive guilt about my shortcomings as either a physician or a father. Ultimately, I feel like I'm better in each role due to my development in the other, and growing into this identity as a father has been challenging, but also rewarding. And this presentation is sort of an ongoing exploration for me in terms of the meaning of fatherhood for me and parenthood. So I have no actual potential conflict of interest in relation to this program and presentation, but what I would say is that I'm talking about fatherhood in conceptions of fatherhood are linked to views on gender and sexuality. And fatherhood is culture bound and contextual. And that's no less true today than it was in Freud's era. And so my own experience as a white, heterosexual, cisgender American man colors my views. But while I include personal and family history with fatherhood, I hope to have a broader discussion about themes and experiences that all parents face. So the objectives of today, I'll be discussing some psychoanalytic theory and literature on the subject of fatherhood. I'll describe some changes associated with fatherhood, including psychological changes, physiological changes, professional changes, and we'll speak about the influence of history, culture, and media on conceptions of the father and parenthood. So first, I'd like to present a case, so you can read along with me. I want you to imagine that a patient you've seen for many years in your primary care clinic presents for their annual well checkup. Robin works as an advertising executive and recently started a family. After a short period of leave, they've returned to full-time virtual work. Robin's partner also works, and they have their infant in a local daycare center. Last week, there was a positive COVID case in their child's room, and Robin was forced to call out of work to watch the baby under quarantine. While they expected that it would be difficult to become parents, the level of fatigue and guilt has become overwhelming. They struggle with finding a sense of balance between work and family. So I want you to imagine that you're sitting in front of this patient, and my question would be, what recommendations would you offer? In the interest of time, I'll share mine. My first reaction to something like this would probably be in the back of my head, yeah, tell me about it. I'm struggling too. And maybe I would offer a sort of comment such as, maybe things will get better once Omicron peaks. We'll see. But I think my other thoughts are assessing for supports in this person's life, their work functioning, relationship with their partner, and how bonding is going with their child. If we're talking about treatment, therapy might be an option, medication could be an option depending on their psychiatric history. I'm sure you have other ideas on what you might share with this patient. I want you to also ask yourself, when you're imagining this case, Robin, was there an association with a specific gender? I purposefully used neutral pronouns and a neutral name. I'm guessing on first glance, some folks imagined the woman. And so I wonder, do we as clinicians have an unconscious bias towards recognizing the stress of parenting in mothers and perhaps overlooking it in fathers? I don't know if this is the case. I think many men still function in more traditional roles and have fewer responsibilities. And traditional views of masculinity often are around being stoic and being a breadwinner and less concerned with relationships and childcare. I think even in egalitarian relationships, heterosexual relationships, women perform more household and caregiving activities than men, even as they're exceeding men in the workplace and in academia, even if not getting paid equally for it. So many men over the course of the last few decades have been moving more into the domestic realm, especially today in the pandemic. So perhaps these kinds of complaints will become increasingly common among fathers, and they're worth looking for. So I like this riddle I found. Two fathers and two sons are walking together. How many men are there? First thought is, it's easy. 2 + 2 is 4. But according to legend, the right answer would have been there are 3: the father, the son, and the grandson. 2 are fathers and 2 are sons. And so I think this highlights the intergenerational transmission of our definitions of fatherhood and expectations for fatherhood. And I'd like to start by sharing some of my own family history as it relates to this. So this is a picture of my grandfather, Louis Luzim. Louis is my middle name, and I feel connected to him. However, I never had a chance to meet him. He's only a couple of years younger than I am in this picture, and as you might surmise, he was a veteran of World War II. He served in an army unit that made its way through Italy. He received the Bronze Star for his efforts constructing a bridge across a river under enemy fire, something that I can't really imagine. And this was just one of several stories I heard about him that gave shape to this unknown figure. So he was a first-generation American. He was born in Brooklyn. His parents immigrated to this country right around the turn of the century from what was referred to as the Pale of Settlement. They were looking for a better life in America and started a family here. And so he was a pretty reserved personality, so I hear, and sort of outshined by his boisterous sisters. As he got older, he worked in the garment industry with family, among other jobs. And family lore has it that he was a talented, ambidextrous baseball player and had a tryout with the Dodgers. He got introduced to my grandmother shortly before leaving for the war, and they corresponded through letters, some of which I've actually read. And what started as a sportive friendship developed into love and courtship. And when he returned, they got married and started a family. He went back to work in construction and as a truck driver. And so my father was the middle child of three. And that's him in this picture here. You may recognize the infant sitting next to him. That's me. Sadly, my grandfather developed cancer, which led to his premature death at the age of 55. My father was only 15 at the time. He recalls a sense of shock and feeling that his family's life and his personality had been changed indelibly. Through a large degree of stoicism, he supported his mother and sister at home. He worked, and he eventually moved into his own apartment. He attended Brooklyn College, where he earned a degree in accounting and played college baseball. My grandfather's death, I think, had a very big effect on the entire family, and I think some of that reverberates today. I've tried to understand how it colored my dad's conception of fatherhood as he grew older and started his own family. And these questions gained even more primacy with the birth of my children and my own foray into fatherhood. Here's a picture of my two sons, Thomas and Oscar. They're now ages 4.5 and 1.5. This picture was from last summer. So I wonder, how have I come to understand fatherhood? As I said, it's an ongoing process, but this question serves as a genesis for this Grand Rounds presentation. Why is this important? I mean, personally, when I think about this, it takes me to a place of wondering what kind of father Thomas and Oscar might be someday. I think about what are the challenges, what are the benefits of fatherhood, what are the conflicts, what are the possibilities? In a professional capacity, are there clinical implications? Are there ways we should approach patients who are expectant or new fathers? So I sit before you today as a burgeoning psychiatrist, and I want to recognize my debts to those who came before me. It's not lost on me that my father can recall his family of 5 sharing a one-bedroom apartment and living on the wages of a manual laborer, and now he can watch with pride as his own son enters the medical profession. So I wouldn't be here today without his hard work and sacrifices to provide opportunities to me to understand myself and to thrive. And I also want to thank my mother and my wife, Ashlyn, for all of their love and support. They've also played an integral part in shaping my understanding of parenthood. So going back to the objectives for today, and starting with the first one, thinking about some of the psychoanalytic literature around the subject of fatherhood. We'll start with a man, called the father of psychoanalysis. Here's a picture of Sigmund Freud with his daughter, Anna. Often when we think of Freud, we think of the Oedipus complex, his theory of psychosexual development early in his career. And his conception of the father in that theory was, depending on the sex of the child, a bit different. But for the son, the father was thought of as a rival for the mother's desire, and therefore created this fear of castration. For daughters, the father is could be thought of as a target of seduction, and instills a feeling of penis envy in a woman. I think psychoanalysts today spend more time apologizing for this theory than using it to formulate cases. It hasn't been well supported by any empiric evidence, and some critique it as a cover-up for sexual abuse even. And it's clearly has patriarchal, I was going to say undertones, but I don't think they're that hidden. There are rigid assumptions around gender roles in this theory. So I want to turn now to a paper I came across to sort of guide the rest of my discussion of some of the psychoanalytic literature, and talking about the evolution from Freud's day to today. And so in this paper, the criticism is that psychoanalysis privileges the symbolic Oedipal father. And over time, there was increased study of focus on the mother. There are important figures, including Klein, Winnicott, and Bion, who played important roles in this. Klein was perhaps the first one to focus on the mother's role in the child development. Winnicott came up with conceptions such as primary maternal preoccupation, where the mother's whole sort of essence is focused on the infant child, and thought about ideas of holding and containing a child and their affect or emotions. And famously, he had an adage of there could be no baby without a mother, which just necessarily is true. And in this context, the father was sort of overlooked and was often spoken about only when there was a paternal absence or neglect or abuse or other negative dynamics that may affect child development. And so a quote from the paper, fatherhood has been largely disregarded as a developmental phase for men. The study is relatively new within psychoanalytic developmental theory, and until recently, actual fathers were seldom thought of as contributing to their children's healthy development. Their role has been unwittingly ignored or devalued, and research on fathers has been scant, particularly as to what constitutes good enough fathering, which harkens back to Winnicott's good enough mother, who I'll get into a little bit more later. So this first wave of conceptualizing the father, we'll go one by one through these waves as conceptualized by Diamond. It's a bit wordy. I'll read through these quotes. I hope you can follow along. I think it's the best way to just try to encapsulate some of the changes in theory. So in this first wave, this symbolic father, the role in this theory is that the child's cutting off of the symbiotic regressive tie to the mother by turning from the mother to the father is a victory of intellectuality over sensuality, a thought process over a sense perception. And so the father gets symbolized as the reality principle, and is what instills cultural inhibitions by creating and maintaining laws against stuff like incest and sort of enmeshing with the mother and sort of launching them out of the family unit. The second wave involved father being thought of as more involved and sort of serving as an attractive function. And so the father becoming himself an object of desire and occupying this non-mother space and promoting the child's exploration of reality. And so the male's separation from this quote unquote feminized sphere of childcare is no longer presumed now that more positive notions of paternal presence and increased direct involvement are occurring. Here's a picture of my younger son, and I guess I thought of this picture because even in the midst of a pandemic, I sort of feel this urge to bring him out into the world, sort of introduce him to society and sort of forge our own relationship, even with the risks involved. Third wave might be thought of as sort of combining this symbolic father function with the actual father. And so Diamond feels like the father today is a significant figure in his child's development, both as a dyadic, meaning having a relationship one-on-one with the child, but also as a triadic object, so being a third party to sort of mediate the child-mother relationship. But the father can also be thought of as an internal object and an intrapsychic representation in the child, what they think of if they close their eyes or imagine what a father is, what a father should be. And lastly, a figure in the mind's basic triadic and Oedipal structure. And so when we think about the good enough father, one thing that's highlighted is an effort to provide the parenting his child needs. Fathers, but not just fathers, parents in general must be engaged in trying to distinguish and protect, and ultimately helping to cultivate what is unique and separate about the child. And so this brings to mind mentalization and being able to see difference in your child and understand it. Here's my older son, Thomas, being unique and, being silly, which is fun to see sometimes. So this paternal function could be generalized to what you might call thirdness. And I think it's important to think about this not just in terms of fathers, but also for, in this quote, what's referred to as father surrogates. So it could be women, could be gay fathers, could be uncles or other extended family members. And this thirdness is important for the child's development. There's more recent literature by an author named James Herzog, who is, some of you may know, he's in the Boston area, and came up with the concept of father hunger. And quote here sort of represents that. So a boy needs his father for the formation of the sense of self, the completion of separation, individuation, the consolidation of core gender identity in the beginning, modulation of libidinal and especially aggressive drives. I call the affective state which exists when these needs are not met, not being met, father hunger. And so I wanted to provide maybe an example of this. Some of you may be Bruce Springsteen fans. This is a song of his that speaks to his relationship with his father. His father had mental health issues and was at times sort of an absent figure in his life. His mother was the breadwinner. I'm gonna bring up a clip of him. You can't really see it, it's more for the audio, describing the how he thinks about this song. So let me just toggle back to share my screen differently. Let's see.
I used to, I had this habit for a long time. I used to get in my car and I would drive back through my old neighborhood, my old town that I grew up in. And I would always drive past like the old houses that I used to live in. And I'd do it sometimes late at night when I used to be up at night. and I got so I would do it really regularly, 2, 3, 4 times a week for years. And I eventually got to wondering, what the hell am I doing? And so I went to see a psychiatrist, and this is true. I sat down and I said, Doc, for years I've been getting in my car and I drive back to my town and I pass my houses late at night. And, what am I doing? And he said, I want you to tell me what you think you're doing. I said, well, that's what I'm paying you for. So he says, well, what you're doing is there's something bad, and you're going back, thinking that you can make it right again. Something went wrong, and you keep going back to see if you can fix it, or somehow make it right. And I sat there and I said, that is what I'm doing. And he said, well, you can't.
So I'll stop there. I wish we had time to listen to that song. It's a good song. But I think, Bruce Springsteen's not alone in having sort of unresolved conflicts related to their own fathers when looking back on their lives. So I'm going to move on from here, and we're going to jump into changes in fatherhood. I really like this study I found. It was a systematic review of 22 qualitative studies over the last couple of decades from several countries, most of them the UK, although, I think one in Taiwan, one in Japan, and Australia. And so they looked at 351 first-time fathers, and they explored their experiences and their needs in relation to their emotional well-being in the transition to fatherhood. They identified 7 themes when they analyzed the content of those conversations. I think one way of going through this is offering some examples of the actual comments the men in the study made. A lot of them speak to me and maybe to some other parents out there. And so, starting with new identity, this father talks about changing his lifestyle and this new responsibility, a new person to care for, and a sort of need to maybe mature and grow as a person. Lots of other men also talked about the desire for financial security and being able to provide for their family, thinking about the future more in those terms. Similarly, there's I think an anxiety around being a dad. This quote I think is illustrative of maybe a first-time father bringing your child home from the hospital. He says, I put him in the cot in his springy seat thing, but what am I supposed to say to him? Am I supposed to just play with him, cuddle him? Am I supposed to, and I don't naturally sort of feel, I just don't know what to do. And so while there's an appreciation of this new identity, I think there's a steep learning curve. Another theme they highlighted were competing challenges. Maybe the most obvious is balancing work and family. So here's a father saying you're building a career, and as a result, you're not getting the quality time to spend at home. You're wanting both, and if you don't have one, you haven't got the other half. You know, it's really frustrating. I mean, just last night, as I was seeing some therapy patients in my office, the bathroom below me, I could hear my wife bathing my two children, and you know, them getting a little wild and screaming, and you know, supposed to be using my third ear, if you will, to try to think about the process and the relationship in therapy. But my third ear was, you know, worried about my my children's welfare and feeling a little sorry that I couldn't help my wife. And so this kind of thing definitely resonates with me. I think there's also maybe unrealistic expectations for how quickly this process happens and how easy it is to bond with a child. So here's a father expecting that, and you know, in the end, he says, I was surprised I wasn't overcome with feelings for him straight away. And so perhaps differently from a mother who may be breastfeeding or has been on this journey for 9 months in a more visceral way, it may be harder for fathers to feel that bond and that connection. Another theme, negative feelings and fears. And so this is a man just describing his anticipation of labor and worried about just surviving that, even though he's a passive observer. Here's another father saying, you know, you're not sure what you're supposed to be doing. And there are times when you have this emotion of complete helplessness. So, you know, some dads are feeling like they don't have the sort of the knowledge or the skills to step into this role. Stress and coping was another theme. Here's a father saying, I didn't quite understand. I don't think I understood how full on babies are. They're 100% and more. They take over your life, and you don't have a life in effect, really. And then how do fathers cope with that? Often with irritability and fatigue, sometimes through denial or finding other avenues. Here's a father admitting that he can feel pretty helpless and maybe impotent as a dad, but he likes going into work and sort of avoiding those feelings because he can feel like he's in control, feel like he's accomplishing something at work. And so perhaps not the best way to cope when one wants to be present in the child's life, and how important that is for that. Some fathers felt like they didn't have enough support, didn't have people who understood what they're going through around them. Some felt like a spare part in terms of dealing with healthcare providers. When asked sort of what they want, what they need, this father talked about more information about just practical information of little things like what clothing, when do you put it to bed, getting into a routine, even the basics. And here's another father saying, I looked at YouTube, but you don't know to 100%, is it something good or can it be harmful? And so, some fathers don't know where to get the information. It's not all bad, some positive aspects of fatherhood, some examples of them. Here's a father saying, the nicest bit is just sitting around in bed and playing with him, talking to him, being talked back at, changing his nappy when that happens. And, looking at him and him looking at me really is that bit I'm really enjoying. And here's another dad kind of talking about the process of learning on the job. And this resonates with me too, of with a pre-verbal child, what do you need? How do I help you? What are you trying to tell me? And so he says, is it his nappy? Is it his food? Is it sleep? And you go through that list until you find something that makes him quiet. And you go, well, I guess it was that then. And you start to notice these signs a little more each time. So I'm going to quickly keep on moving and move on to physiological changes. I came across this entity of Kuvad syndrome, which I hadn't heard about before, but essentially it's like a functional disorder, and the expectant father can experience somatic symptoms like indigestion, changes in appetite, weight gain, diarrhea, constipation, headaches, and it usually resolves with childbirth. It made me think of this movie. I'm a Arnold Schwarzenegger fan. Not his finest work, but the truth is there is evidence for fathers gaining weight. Here's a study comparing non-fathers to resident fathers, and then also fathers who don't live directly with the child. And while there's a trend of weight gain over time for all of them, you really see this pronounced increase in fathers and a sort of leveling off for non-fathers. Not a huge change. We're talking about like half a point in BMI, but you know that could be 5 or 10 pounds, which is not insignificant. You know, boys and men also are bombarded with images of, you know, what it means to be male or masculine. I was pleasantly kind of surprised to discover this new term being thrown around of the dad bod. And if you Google dad bod, one of the more likely images to come up is of Seth Rogen. And so I thought, hey, if that's the expectation, that's doable. You know, I'm not going to look like a male fitness model, but you know, I think that's realistic. And then it wasn't too long after that where I came across this link of Zac Efron's quote unquote dad bod, and I thought, well, what happened to Seth Rogen? And so I guess all this is to say is that, you know, men are also not immune to shifting commentary around weight and body image. I wanted to bring up another video real quick of a doctor named Ruth Feldman, who has a lab in Israel. Try to bring that up. Sorry, I've lost that. Let me see if I can.
What is happening with fatherhood? And I think fathering is, in my opinion, fathering and father's brain, in my opinion, is one of the most exciting topic, not only in developmental neuroscience, but in evolutionary theory in general, because I think looking at father's brain is the one place, is the one window we have to evolution as it occurs. Because you see, let's say the 30 years between the time you were a dad and your son is a dad made tremendous changes in fatherhood. Fathers are now much more involved, and they share childcare responsibility, and they play with children, and there is really a sharing of childcare responsibilities in many, many contexts, not in everything. And then you see that father's brain is so plastic that it evolves according to how much childcare this father does. So even though mothering is, the mother's brain is primed by the hormones of pregnancy and childbirth and nursing, father's brain can activate the same network via a different process.
How does that work?
It works that mothers activate the more ancient limbic subcortical system, and through that they activate the more mirror system, the more mentalizing system in the brain, the social brain, the cortical social brain. Father works the other way around. Father's pathway to the paternal brain is through understanding the infant, trying to predict the infant intention, trying to predict what kind of cry the infant has. And that activates it's more cognitive, socio-cognitive processes, you know, temporal or temporal-parietal structure, where fathers try to imagine what this nonverbal cry means. Is the kid tired? Is the kid want to eat? Does the kid want to play? And that goes from top to the bottom, and that activates that early ancient mammalian caregiving network of subcortical structures. So in mothers, it goes from the depth of the brain, from mammalian general, something that happens in all mammalian mothers, to the top. And in fathers, surprisingly enough, it goes from the top to the bottom. And the more father is active in taking care of the child and really listening. A lot of time we get feedback from fathers that they say, oh, I didn't know how important I was for my infant. You know, I thought the mother is important for the first 3 years. And then, you know, I come in when the child is, you know, I can talk to him, or I can take him on trips, or I can take him to the ball games. And this is what part of, I think, the importance of our study, showing that the male brain, father's brain, is just as plastic as the female's brain. And if you don't get involved with the child and learn moment by moment to respond to his signals, it's not going to happen to you. It's not like every woman who is pregnant, there's going to be an increase in oxytocin. You are not going to be involved during this sensitive period. It's going to pass you by. And what a lot.
So I'm going to stop there and get back to my PowerPoint. So this is a study that came out of Dr. Feldman's lab, and what we see here is functional MRI images, and their parents were given infant stimuli, interestingly, this is an aggregate of 3 different parental groups, but they all had a similar network that was discovered here, and so. There were primary caregiving mothers, there were heterosexual secondary caregiving fathers, and then there were primary caregiving homosexual fathers without maternal involvement. And so they came up with this global parenting caregiving neural network, and you know, one striking chart from this paper. You know, in terms of the functional connection between the amygdala and the superior temporal sulcus, which is involved in this this network, you see the connectivity go up with more and more hours spent alone with the child, and so it's there are neuroanatomical you know, consequences to fathering behavior. And so there's a lot of research still to be done, but finding sort of the biological mechanisms at play behind fatherhood is will be an important thing moving forward. I want to quickly touch upon hormonal changes. There are more hormones involved, but these are some of the major players. In general, testosterone goes down, oxytocin, vasopressin, prolactin go up. there's an interplay between all of them, and can affect, fathering behavior. The idea of sort of evolutionarily why low levels of testosterone may be helpful is could increase empathy for infants, suppress aggression towards them, and perhaps suppressing sexual motivation that could divert them from parental care or lead them to, fathering other children. And importantly, this seems to be a consequence of fatherhood rather than a cause of becoming a father. In another study, when they traced men over time, they actually saw those with the highest T were more likely to have kids, but that once they had kids, they had the biggest drop in testosterone. So it's clearly a sort of secondary process. Here's another interesting study where salivary, I don't know if it's salivary, it was testosterone was measured at different time points in a father, and you see, for non-fathers, not much change, but for fathers of younger children, a bigger drop in the testosterone. And similarly, you see a bigger drop in testosterone with time spent with children. Oxytocin is also, very important in bonding. We know that from other research. In this study, they recorded about 100 moms and dads playing with their 4 to 6 month old infants and coded the kind of play. And so what they noticed when they measured oxytocin both before and after the play was for mothers who were on the higher end of affectionate contents or contact of holding the baby, gently, they saw increases in oxytocin after doing that, as one might expect. With fathers, it was somewhat different. There's more stimulatory touch, throwing the child around in space or playing with them, more physical play. And it was that was associated with an increase in oxytocin. And other research has shown that children's oxytocin levels mirror their parents. And so there's a way that there's a feedback of encouraging these kinds of different play and interactions with children. And so this is just to show that this combination of low T and high oxytocin likely contribute to more involved parental caregiving. Vasopressin, there's not a lot of evidence for its role in human behavior, but they have seen higher levels associated with those with young children and those who have stimulating play with children. This was just a study that put fathers in a virtual environment, and when given vasopressin, it showed that they spent more time attending to basically virtual children than before. Prolactin's also something we don't have a lot of information about. This is a picture of a marmoset. They've been studied because of their very involved male parents, and they've seen high levels of prolactin in animal studies. I'm going to quickly touch upon some professional changes. This cartoon resonates with me. I love my kids, but also, it's nice to get a break and to try to have that balance. Both work and family can be exhausting and can lead to burnout in their own ways. speaking of that, in a survey of 2,000 parents, and these are all types of parents, different work, 60% talked about burnout. Nearly 90% thought it was harder to raise children today than before. And there were some factors that were identified as creating this atmosphere. In terms of maybe for our audience of thinking about parenthood and medicine, this was a study that looked at physicians actually over this period of time were more like or showed increased rates of burnout and decreased rates of satisfaction with work-life balance. I would love to see a chart of 2019 to 2022. I think that would be quite interesting. Obviously with the pandemic playing a role. Here's another study showing that both male and female physicians were more likely to report their career had a negative impact on relationships with their children. You can see between physicians and regular population, the positive impact is pretty consistent in terms of work and family, but the negative impact is much higher among physicians. One nice thing perhaps is that over time it seems that physicians see the impact or see that positive impact grow over time as they advance in their careers. We have very little time left, but I'm going to quickly jump through a few sort of historical, cultural influences on fatherhood. Some just changes in our society that have led to changes in fatherhood. Women's increased labor force participation, so it was largely associated with World War II, and workforce participation for women increased from roughly 30% to about 60%. It's also been a sort of change in the average family, moving away from a nuclear family and having higher rates of absence of non-residential fathers, but also those that are in these traditional families. There's been an increase in fathers' involvement in these families, so there's sort of a diverging path there. And our society has just changed culturally and demographically, which will change our definitions and our expectations for fathers. I have some quotes from the American Psychological Association and their when they talk about quote unquote modern father. And the important thing that they mention is that fathers are involved. And so whether he may be classically married, single, divorced, widowed, gay, straight, adoptive, a stepfather, stay-at-home dad, or the primary family provider, doesn't really matter. Like having that third party, having that secondary parental figure can play a huge role in a child's life. Modern Family show people probably are familiar with. It came out in 2009. Almost seems outdated already, but I remember being an adolescent when Ellen DeGeneres had a show on TV, and that was thought to be pretty groundbreaking. And so I do think in some ways this is a big deal in terms of normalizing things. Like the family structure wasn't really necessarily like the plot point. It was sort of secondary to it being a sitcom and a comedy. So another sort of definition of the modern father, no longer always the traditional married breadwinner and disciplinarian. He can be single or married, externally employed or stay at home, gay or straight, adoptive or step parent, and a more than capable caregiver to children facing physical and psychological challenges. father's affection and increased family involvement help promote children's social and emotional development. Pete Buttigieg, recently with his husband adopted twins and was in the news regarding that. I think he's a presidential candidate, now the Secretary of Transportation. So having public figures, demonstrating the changing conceptions of fatherhood, I think is really good and illuminating. Here's a quote: as a high-profile leader who's unapologetically taking time off to care for his family, Mr. Buttigieg may be the father figure we all need. This came from an article in the Times talking about paternity leave, and this was in the context of legislators trying to pass guaranteed paid family leave, which has not occurred. There's some hope that there might be an avenue for that in the future. In that article, they reference Sweden, which has a much different view on parental leave and fatherhood, perhaps than our country. And one thing they argue in this is that parental leave can introduce fathers to the responsibilities of childcare and housework. And when queried, 95% thought it resulted in a closer relationship with their child, and 44% found it led them to be more helpful in housework. And then 70% felt like it had a positive influence on the partner's ability to work or study. And so I wonder, will the pandemic create a shift in consciousness for fathers, sort of like World War II did for women? Maybe this is that significant of an event where it might shift sort of the way our culture approaches these things. Here's another Times piece that I've found, and they quote this research. This was only a few months into the pandemic, and you see men doing and women, fathers and mothers doing more work, both. So kind of summarizing, so you can see this emergence of a softening and changing of traditional parenting roles. The transition in economics, urbanization, and sexual roles led to more open, flexible, and undefined functions for fathers. I'm going to close in the last minute or two with kind of bringing it back to sort of a kind of personal story. I won't read this entire thing, but this is an email my dad sent to me. I want to thank him for giving me permission to share this. This was after like a third attempt at an ablation that led to him having a pacemaker placed. And I'm not going to make any deep interpretations of this material, but in this moment of sort of maybe somewhat confusion, somewhat fear, he called to mind certain images of fatherhood that seemed to provide some comfort. It was clear to me that he has an internal representation of his own father, and then he looks to his personal identity as a father that as a strength. I think it also illustrates the role of sports in mediating male relationships, and we've talked about how physical play can complement mothers' strengths and more in the emotional realm. I think it's worth noting that my dad did find some father figures in his coaches, as high school football coach and college baseball coach. My reaction to this, I was kind of struck by my dad's candor, and I think maybe because I was contemplating his mortality, I found it challenging to respond. I eventually thanked him for sharing this with me. Ultimately, I realized that he had provided an answer to some of the questions I brought up at the beginning of this presentation. And despite the absence of his father, he was able to develop his own identity as a dad and then serve as a model for me and my siblings. It's a real joy to see him interact with my own kids nowadays. He offers advice here or there, but he also helps me tolerate the anxiety of parenthood. Often in his characteristic humility, he'll tell me, there's no instruction booklet. You do the best you can. And I think that's maybe the most concise way of describing the good enough father. But in many ways, my dad was great. And so, one last thank you to him for everything he's done for me. Here are my references. I'm going to stop here. I don't know if we have much more time, but I want to thank everybody for listening to me today.
Thank you so much, Derek, for this very interesting topic that we don't really cover too often, and for bringing different perspectives. We do have one question and a comment. Dr. Ewok asked, what is the latest thinking on the relationship between absence of fathers and conduct antisocial problems? Did you come across this?
I haven't looked at the most recent research. I know there's evidence in the past of absent fathers, children being more likely to develop behavioral problems. I'd have to look into the more recent literature around that. I focus more on the sort of increasing involvement of dads and the consequences of that, but obviously their absence, is still important too and influential.
And Dr. Benjamin makes a note that some of these issues return at the onset of grandfatherhood. So there may be a part 2 of these grand rounds, but related to grandfathers. I don't see any other questions, and I know we're a little bit over time, but thank you again, and thank you all for joining.